San Diego County still has tens of remaining in federal pandemic relief funds, and many are wondering how it'll be spent.
CBS 8's Richard Allen is here now with what's being proposed at tomorrow's Board of Supervisors meeting. And Richard, we understand that is not the only high priority item on the agenda.
Well, that's right. One of the key decisions to be made at tomorrow's meeting, it's the first regular meeting of the year, is who will lead the board in 2024. And also on the agenda is how to spend roughly $80 million in federal pandemic relief funds, money that has to be spent by the end of 2026. Now, two major proposals center on creating more recuperative care beds for homeless San Diegans and also increasing the number of behavioral health care workers here in the county.
A really unique and creative funding stream so that we're able to get the biggest bang for our buck.
Supervisor Tara Lawson-Remer is proposing using part of these funds for a new recuperative care center, able to take in patients after hospital treatment, providing roughly 100 beds for unsheltered San Diegans. This new proposal, which would prevent a backlog of available beds in full-service hospitals, would essentially double the current number of recuperative beds available countywide. Lawson-Remer says this would require about $8 million in county funds and would bring in about $35 million in operating funds over the next 5 years.
What's really exciting about this proposal is we just would need to invest the upfront money to build the facility, but then the ongoing costs for the operation and maintenance, the ongoing care, that would be reimbursed and would be paid for by the federal government.
In this instance, they're life-saving.
John Brady is executive director of Lived Experience Advisors, a group of formerly homeless individuals advocating for those who are unsheltered. He says funding more recuperative beds countywide is critical for San Diego's homeless population.
People need surgeries. They're life-saving surgeries, but they have to have a safe and sterile environment to recuperate in while they're in the recovery, and we do not have those beds.
Another proposal for these funds is to spend $24 million to increase the number of behavioral health care workers in San Diego County. A recent study by the San Diego Workforce Partnership finds the county will need 18,500 more behavioral health care workers by 2027.
So we're going to be training and helping skill up a whole bunch of behavioral health workers across the county, as well as supporting some of our smaller community clinics.
And already some of these federal funds have been approved to help support migrants seeking asylum to move on to their final destination and also increase the number of recovery beds in substance abuse treatment facilities. And also on tomorrow's agenda, the board will consider updating its public participation rules during public comment. This is to try to crack down on disruptive or harassing behavior. One option actually includes reducing the amount of time people have to speak. Tomorrow's meeting starts at 9 a.m. Jesse?